Do you know what GERD is and how it affects your health? Let's dive right into it. GERD, or gastroesophageal reflux disease, is more than just heartburn. It's a chronic digestive disorder that primarily affects the lower esophageal sphincter. Now you might be wondering, what's that? Well, it's the ring of muscle that acts as a gateway between your esophagus and your stomach. In a healthy body, this muscle opens to let food into the stomach and closes to keep stomach acids out. But in people with GERD, this muscle is weakened or dysfunctional, allowing stomach acid to flow back up into the esophagus. This backwash, known as acid reflux, can lead to the irritation and inflammation of the esophagus, causing the discomfort we associate with GERD. Many people may not realize that they are experiencing symptoms of GERD, so it's important to understand what to look for. So, what exactly causes this uncomfortable condition? At its core, GERD is a result of the lower esophageal sphincter, or LES, not behaving as it should. This ring of muscles acts as a gatekeeper between your esophagus and stomach. When the LES is healthy and strong, it keeps stomach acid where it belongs, in the stomach. However, if the LES becomes weak or relaxes when it shouldn't, it gives the stomach acid an open invitation to flow back, or reflux, into the esophagus. This is what causes the discomfort that is characteristic of GERD. There are several common factors that can contribute to the weakening of the LES. Obesity is one, putting pressure on the stomach and LES. Pregnancy can also have a similar effect. A hiatal hernia, where the upper part of the stomach pushes up through the diaphragm, can cause GERD. Certain medications too may contribute to this condition. Now that we understand the causes, let's dive into the symptoms of GERD. How do you know if you're suffering from GERD? Well, there are several telltale symptoms to watch out for. The most common one is heartburn, that all too familiar burning sensation in your chest, just behind your breastbone. This usually occurs after meals and might be worse during the night. Another common symptom is regurgitation, or the feeling of acid backing up into your throat or mouth. This can produce a sour or bitter taste and can even lead to vomiting. Difficulty swallowing or a sensation of food stuck in your throat is also a frequent sign of GERD. But remember, GERD can be a bit of a chameleon. Some people might experience less common symptoms such as a persistent cough, laryngitis, or disrupted sleep, all of which can be caused by stomach acid irritating the throat. Recognizing these symptoms is the first step towards seeking help. Let's now explore the treatment options for GERD. If you're experiencing symptoms of GERD, what can you do about it? There's a range of treatments available, each tailored to the severity and frequency of your symptoms. For mild cases, lifestyle changes can be incredibly effective. This can involve altering your diet to avoid trigger foods, losing weight if necessary, and not lying down immediately after eating. When lifestyle changes aren't enough, over-the-counter medications like antacids, H2 blockers, or proton pump inhibitors can be the next step. These work by reducing the production of stomach acid, giving your esophagus a chance to heal. In more severe cases, prescription medications may be required, offering a stronger line of defense against stomach acid. Finally, in the most extreme cases, surgery could be considered. Procedures like Nissen fundoplication or Lynx device implantation can help strengthen the lower esophageal sphincter, reducing the chance of acid reflux. Remember, treatment should always be guided by a healthcare professional. With the right treatment, living with GERD can become much more manageable. To summarize, GERD is a common but often misunderstood condition. It's a chronic digestive disorder, triggered by various factors, presenting diverse symptoms and treatable with a range of options. Knowledge is the first step to health. If you think you may be experiencing symptoms of GERD, don't hesitate to seek medical advice. Stay healthy, everyone.